How do we fix the primary care crisis in Saint Croix? I don't want to be vague about this. Uh, the writ has dropped. We are at episode 100. You are looking for real solutions as you decide where to place your vote on October 21st or before. Advanced polling. You can start voting very soon. And I want to talk to you about what it's going to take. And the Greens party, the deputy leaders, the three sitting MLAs, toured New Brunswick earlier this year on an endeavor that they called Healing Our Healthcare. And what it comes down to is an end to centralization. So, yesterday, if you joined us, you heard me talk about how, even just as someone who is trying to set up a campaign in St. Croix, there is the Green Party office in Fredericton. But if I depended on them to figure out where to put a campaign office, where to do a campaign launch, where to find volunteers, et cetera, all the logistical things, where to put signs, they would say you need to get out in your community and find the people and find the places. So we know this intuitively, and yet somehow when it comes to our tax dollars, we think that, oh, if we pull things out and centralize things, uh, somehow it'll be more efficient. It's completely counterintuitive. So when we see problems at our local hospital, for example, which we love, our Charlotte County Hospital, it is a gem, it is a jewel. Previous governments have tried to close the emergency overnight. The surgical centers, two operating rooms in that hospital, have been closed. The chipping away at our services, our rural services, which are crucial to serving more than 25,000 residents in the surrounding area, have been chipped away at. But when you look at the administration of that hospital, if you just Google, for example, Charlotte County Hospital staff, you will see that an executive director in Horizon Health is responsible for that hospital, but not just that hospital. That same executive director is in charge of administrating the regional hospital in St. John, St. Joseph's Hospital in St. John, the Sussex Medical Center, and Grand Manan Hospital, and our hospital. 5 hospitals. Okay, one executive director. I would say it's a full-time job administrating one hospital by itself, and that is the kind of thing that Greens want to see. After all, one of our values, our 6 values, I'm going to bring this out again, is local self-reliance. New Brunswick communities must be in charge of their own destiny to the greatest extent possible. I'm reading right from it. Again, you can get this on the website. Resilient, sustainable communities require economies that meet local needs and are locally controlled, minimizing dependency on external forces. Self-reliance and resilience are built on public assets like the hospital, like our medical health facilities, minimize public assets placed in the hands of and dedicated to the service of local communities. Okay. And so we would like to see as Greens an end to things like an executive director who I'm sure she's amazing and competent and wonderful and great at what she does, but 5 is too much. And so on this healthcare tour that David Kuhn, Megan Minton, and Kevin Arsenault did around the province, they discovered stories like a Horizon Health regional administrator who took on the initiative in St. John to connect service hubs of various practitioners to St. Joseph's Hospital and allow some collaboration between different practitioners and contact between them, getting access to primary care to people, getting them into the system. And if one couldn't help them, another possibly could in relationship with the hospital. This kind of thing happened in Rogersville, where there was a team working out of a heritage home that was being rented by Horizon Health, a team of healthcare practitioners, and linked it up with the community health center, linked them up and allow them to communicate. Because if you're looking for a doctor right now, you call you find out there's a doctor in town, you call them, you find out that they're not taking a patient, and that's the end of the conversation. You might even just get a voicemail saying, not accepting new patients, I'm sorry, have a nice day. Then you are back to 811, getting put on a list. That's an example of centralization. You feel it. It's a concept, okay, centralization, but That's an example of you're not being put in touch locally. There's no network. What we would like to see as Greens, there's my timer, and I've got so much more to talk about. As Greens, we would like to see uh, a kind of, for example, you call a doctor, they say, we're not taking patients, but now there's an administrative staff there that will work to put you in touch with some other local doctor or nurse practitioner. So, as Greens, we want to set up in St. Croix, and this is what I'll be working on as your MLA, a community health center. That's a brick and mortar place where we have healthcare practitioners going and working and serving out of that building. At the same time, a two-pronged approach. If let's say if it took a few months to find a building and get that going, or get a lease going on a place like Megan Mitten did in Tantramar, or like they did in Rogersville, um, at the very least, we would open up pathways for a funding model for more administrative staff and connection between. This is something the New Brunswick Medical Society has been begging for. They said, I talked about this past summer in July. I remember I was on family vacation doing the lives and reading the New Brunswick Medical Society report, and how they said we need $600 million to bring the standard of New Brunswick primary care up to a level that matches and meets other provinces. And part of that was a sophisticated system of network, where healthcare practitioners could communicate with each other. That's not being done across the board. There's no funding for that. Our conservative governments have cut, centralized. What we need to see, and what the medical society wants to see, is communication between healthcare practitioners. And it is being done in certain places where certain individuals take the initiative. We see these examples again and again. You're tired of me saying it. I know you are, but you need to know. And that's why I'm so optimistic as your MLA. I wouldn't be taking this job if I thought it was a big, hopeless mess. The answers are out there. They have been done in places like Rogersville and St. John and Tantramar by individuals who just took it upon themselves to do so. What we need is systems that start to standardize and normalize that kind of thing. We need to look and say, what did they do? They opened up primary care access to thousands of people collectively. How can we make sure that our system pivots and adapts to do that kind of thing? So in St. Croix, we want to see relief for the hospital by providing local doctors and practitioners with a network. And for you as a patient, before we get our medical health, our clinic, our center, community health center set up, which will happen over the next 4 years. This is not going away. If I get elected, I want you to give me the hand every time you see me and say, how are we doing with the 5 things? Community health centers on there. But even faster, addressing this in that two-pronged approach is opening up communications that if you were to call a doctor, you wouldn't get sent back to 811 and put on an endless waiting list. What happens is we start to see collaboration between medical healthcare professionals of all sorts that say, what kind of help do you need? And when you make that call, you are directed where you need it. And that, of course, goes with our commitment to making access to primary care a right, which means 20% of people who are not accessing that care right now have no access to that care. That's unacceptable if it's a right that you get to access primary care. Okay, I'm going to leave it there. I'm sweaty, I'm crusty. It's probably a good thing you can't smell me right now. There's a screen because I have been putting up signs since 12:01 a.m. last night. The writ dropped today. It's election season. So I was out with the team hammering in signs. Thank goodness it's a beautiful, hot, sunny day. But I am sweaty and sun-soaked, and I am going out to put up more signs this evening. If you would like a sign, please message me. We will get one on your lawn. I would love, because it's official election season, I would love all the help I can get, either putting up signs or you putting a sign on your lawn and committing to say, hey, I know that Mark is going to work for 5 major solutions to things that we need in St. Croix right now. No other candidate is committed to doing that. Those other candidates are just going to do what their party leader decides St. Croix gets. The Greens are committed to local solutions for